Okay, so we talked about hypokinetic basal ganglia disorders, Parkinson, and the Parkinson's-like syndromes. Now we're going to talk about hyperkinetic basal ganglia disorders, which are basically kind of the other side of the coin. So hyperkinetic disorders, they involve involuntary abnormal movements. So Huntington's disease, dystonia, Tourette's disorder, and dyskinetic cerebral palsy. So Huntington's disease is an autosomal dominant hereditary disorder, and it causes degeneration in many areas of the brain, particularly in the striatum and the cerebral cortex. So the signs of the disease include chorea, which is those writhing type large movements, and dementia. So people with Huntington's usually know that they have the gene in their family, and they, since it's an autosomal dominant, if you have the gene, you are going to have the disease. So those involuntary, jerky, rapid movements, that's called chorea. There are some videos in the module that talk about Huntington's. So basically the genetic trait causes degeneration of different areas of the brain. So you have excessive output from the motor areas of the cerebral cortex and excessive movement in people with Huntington's. So usually the onset's between 40 and 50 years of age, and the disease is progressive. Usually you have about 15 years after the signs first appear. So the prevalence of Huntington's disease is 7 cases per 100,000 people. And there are no treatments currently that alter the course of the disease. So it's pretty sad, I guess. Dystonia is often genetic. It's usually not progressive, unlike Huntington's, which is progressive. Movement disorders are characterized by involuntary sustained muscle contractions causing abnormal posture, twisting, and repetitive movements. So dystonia often increases during activity and emotional stress and completely vanishes during sleep. And the tremor is frequently associated with dystonia. So with Huntington's, sometimes the chorea movements decrease during sleep, but with dystonia, they often completely vanish during sleep. So again, this is another one where there aren't a ton of treatments out there. There are different types of dystonia. It's usually associated with abnormal proteins in the PPN, and the PPN is where acetylcholine is produced. So that acetylcholine dysfunction is frequently associated with dystonia. So Tourette's disorder causes vocal and motor tics. The onset's usually during childhood. It involves abrupt, repetitive, stereotyped movements. A lot of people with the disorder, they're aware of the fact that they have these sensory urges that precede the tics, and stress, emotional excitement, and fatigue can exacerbate them. They can be temporarily and voluntarily suppressed, but the urge to tic builds up during suppression. So the stereotypical Tourette's is people yell out obscenities, but it's not always that. Sometimes it's motor tics and movements. So dyskinetic cerebral palsy, abnormal involuntary movements, the abnormal muscle tone and posture, and unwanted involuntary movements, and they're called choreoathetosis. So it's a combination between the involuntary, jerky, rapid movements and the writhing, athetotic movements. So there is another type of dystonia that's called focal dystonia, and it's usually limited to one part of the body, like the hand and or the neck. And so that's a subset of dystonia. With dyskinetic cerebral palsy, you can imagine that the disorder results from something physical that happened to the basal ganglia during birth.